But we start here in this hour. Government plans to ramp up its vaccination drive and open more sites to reach a bigger part of the population. The acting health minister, Mmamoloko Kubayi, has warned although infection numbers are going down, especially in Gauteng, the country is not out of the woods yet. The province has been at the epicenter of the third wave. Let me take you to eNCA's Heidi Giokos, who has been following the vaccination program and joins us live now. And Heidi, let's start with the situation in as far as the vaccine pipeline. What do we know at this particular point about the vaccine pipeline and how those vaccines will be put to use in terms of the strategy shift from government? What do we know at this point? What was revealed at this briefing?
So we do understand, Tulas, that about 47,500 vaccines were either destroyed, stolen or looted during the looting that took place about a week ago. This is, of course, having quite a significant impact. It means that 47,500 vaccines have been lost that were supposed to be part of the vaccine rollout. We know 120 pharmacies have also been looted or completely destroyed, which again has a significant impact on the vaccine rollout. We know KwaZulu-Natal mostly and Gauteng, of course, were impacted because of the looting and the unrest that the country experienced. And we do understand that in the last couple of days, especially KwaZulu-Natal has been able to come back online and administer thousands of vaccines. It's one of the provinces actually that administers almost second to Gauteng in terms of vaccines administered per day. So the minister's saying that even though the country might be over the peak of the third wave, there is still huge concern in terms of the numbers, positive COVID-19 numbers that are recorded daily, and we still need to keep our guard up. Let's perhaps listen to the minister on that.
At the height of the unrest, there were disruptions in all areas of the health system deliveries, in all areas of the health service delivery system. There was a decrease in the number of vaccinations due to closure of vaccination sites. There was a loss of vaccines due to looting. An estimated 120 private pharmacies were destroyed, which led to a loss of approximately 47,500 vaccine doses and loss of damages to the infrastructure that supports the healthcare system as well. Fortunately, or which would be something, because I think it could be as well unfortunate, but we can account that large majority of public vaccine sites were not damaged.
Heidi, the numbers in terms of COVID-19 infections and deaths have been fluctuating, but sort of trending downwards, at least the infections part of it, in the last few days, indicating, as the minister says, that we may have reached the peak of the third wave. But now there's concern that, we might see a continued fluctuation because of the lag in terms of when someone contracts COVID-19 and when they start displaying symptoms and being confirmed as positive and perhaps even needing hospitalization is quite a number of days. With the recent events in the country, there's concern that this could lead to perhaps another surge.
Yes, and I think that's a huge concern for government because testing is significantly lower than usual in KwaZulu-Natal. And if you look at the numbers that are recorded, the positive COVID numbers that are recorded in KwaZulu-Natal, it's still a lot lower. And if you listen to what the acting health minister said today, those that were arrested during the looting that took place last week or so, we understand that a large number of those that have been arrested actually tested positive to us for COVID-19. So the acting health minister is saying that they are very concerned about the cases that could possibly increase, especially in KwaZulu-Natal, saying that if anybody partook in the looting, the unrest, or was anywhere near that vicinity or that area, they need to perhaps go and test, and if they are displaying symptoms, they should take that very seriously. not only to protect themselves, but to protect their communities and their family members. Of course, we understand that those numbers might only come in the next week or so, but what's imperative here is that those that do display any kind of symptoms actually go and test. And that's the concern, that a lot of these people will not be going to test. And then we won't really understand the impact of those gatherings. So that's why the minister is saying that even though the numbers are fluctuating and we're seeing a decrease, if you look at the number of tests that are being done per day, and then how many positive cases come out of that and the positivity rate, there's still a reason to be very concerned, and we still need to keep our guards up and be extra careful.
Lastly, Heidi, to the minister's credit, assembling a panel to respond to what we've seen, vaccine hesitancy, but also people, genuinely expressing their reservations about the side effects, some of the side effects that have been reported in as far as the vaccines are concerned. I think I saw that this was part of the suggestion that she received on social media and actually assembled this panel. It was a suggestion that was made to her, and to her credit, responding to it, not just being dismissive about it, that, if you are if you are hesitant about the vaccine, well, it's your choice, it's your life. What came out? What are the key takeouts from this presentation that was prepared specifically to respond to some of the concerns that some people may have about some of the side effects of the vaccines?
Thulas, I must say we must give credit where it's due, and we have an acting health minister who's extremely responsive, and she responds to almost every single question. Sometimes it might not be what people want to hear, or she might not have the answer straight away. But in terms of hesitancy, and we're seeing a lot of people going on social media reporting that they might have lost a loved one or heard of somebody, a neighbor, family member, friend, that soon after they got the COVID-19 vaccine passed away. And the minister, together with a panel of experts, specifically Professor Glenda Gray, who led the Sisonke trial that saw the Johnson & Johnson vaccine rolled out for healthcare workers, we understand that the evidence and the data presented, not only globally, Thulas, but here in South Africa, the evidence still points out to the fact that the vaccine is life-saving. It prevents severe COVID-19. It prevents hospitalization and, of course, mortality. And, of course, people will have side effects. People will react differently. It's all dependent on everybody's medical condition, individuals' medical condition. And this is why the minister is saying, please be honest when you go and get your vaccine. If you are experiencing something that is not normal to the side effects and symptoms one normally experiences when they get the COVID-19 jab, they need to consult with their doctor as soon as possible so that the departments of health and health experts can investigate this further, so we can understand if there is a serious reaction that people are experiencing with COVID-19. I must just quickly add, Thulas, that the plan is to get about 400,000 vaccines administered per day. By September, they are planning to get mass bulk vaccination sites, what they call. So you'll start seeing stadiums turned into vaccination sites, and they're planning to vaccinate between 2 to 3 million in the next 6 months, starting from August. So the plans are there. We just hope they can be executed to vaccinate at least 35 million people. That's the target government has before Christmas.
Yeah, and I suppose, Heidi, it's important for us to highlight that all medication, as everyone would know, has side effects. And some of the side effects from vaccinations have already been listed, and what you do in case you experience these side effects is also explained at the site at which you get vaccinated. So you weigh up the cost versus benefit, which was done at this briefing today. And importantly, Heidi, let me leave you with this statistics, which I'm pretty sure you know because you follow these things closer than I do. Figures coming from the United States indicate that, about 99% of all COVID-19 related deaths right now are among the people who are not vaccinated. 99% of all COVID-19 deaths in the U.S. are among the people who are not vaccinated. Heidi Giokos, thank you for that. Think about that statistic. 99% of those who are dying of coronavirus in the US right now, we are told, are the people who are not vaccinated.